Hello and welcome to LifeBridge Health's Facebook Live series. I'm Sharon Boston, and today we're coming to you live from the Krieger Eye Institute, where we're going to be talking about taking care of your eyes. We're joined by Dr. John Abrams, director of the Krieger Eye Institute. Thank you for joining us. Before we get started, we'd like to remind our viewers that if you have a question for Dr. Abrams, please post it in the comments section, and remember to hit the subscribe button so you'll be notified each time we go live. So Dr. Abrams, we're all using computers and iPads and iPhones, and people say their eyes are feeling strained. What can we do about that?
Well, there's a lot of reasons that there's eye strain. Sometimes people are concentrating on their screen so much that their eyes can dry out a little bit. So sometimes it's not a bad idea to use an artificial teardrop, before you start using your screen all day or what have you. But also sometimes the screens are at different distances. So depending upon your age and how well you can focus, sometimes you may need a certain prescription as far as glasses is concerned to see what you're looking at. So for example, if you're 45 years old and you don't wear glasses, you might need a weak pair of reading glasses to use your computer. The closer you bring things, the stronger the prescription needs to be. But everybody's a little bit different. But those are the main issues as far as looking at screens. Artificial tears if you're dry, and make sure you have the right prescription.
What about needing to look away every few seconds, or?
Depending on your age, sometimes the looking away from the screen now and then can help sort of recalibrate your focusing muscles. The older you are, it might be a little advantageous to take a little break, for 5 seconds every 10 minutes or so, just look off in the distance. That's helpful sometimes too.
My eye is itchy red and I have some discharge. My kids say there have been some pink eye in her class. Could I have it?
Certainly. Pink eye is basically another word for viral conjunctivitis. And generally the common cold viruses are what cause pink eye. And they're very, very highly contagious viruses. So it's not unusual to have somebody with a child with a little bit of a cold transmit it in various ways. And you can get the other kids in the class can get pink eye, they can get colds, parents can get pink eye. The incubation period for some of those viruses can be 7 to 10 days. So you can actually infect other people before you know you even have anything wrong with you.
Is it touching your eye and then touching something, or how does it spread?
It's pretty much it's sort of a touch-based thing. It's water. Basically, if you rub your eye, you get a little bit of tears on your eye that have the virus in it, and then you shake somebody else's hand, or you touch a faucet and somebody else touches that faucet, you can get it in those kinds of ways. You may not get the pink eye part, you might just get a cold out of it, but they are pretty highly contagious viruses.
And what is the treatment?
Unfortunately, there really isn't any treatment for that. They are self-limited diseases, they go away. In severe cases with some of the severe strains of pink eye, sometimes patients might need steroid eye drops, although we don't encourage that because they have their own set of side effects. But sometimes if it's really, really severe, they need more than just palliative measures like artificial tears or closing your eyes or those sorts of things. Pink eye can last 3 days, it can last a month, depending upon the strain. Generally, if you've got viral conjunctivitis, we don't want you to go to school. We don't want you to come to work. We want you to stay home and not infect other people. And wash your hands a lot.
Someone said, my contacts have gotten uncomfortable and feel dry. Could this be allergies?
Well, there's a whole lot of reasons contact lenses may not be working for an individual. Sometimes the eye changes over time, the shape changes over time, and a patient needs to be refit for a slightly different shape contact lens or a different material contact lens. Certainly allergies can affect how well contact lenses are tolerated. Some people get by with using an allergy drop before they put their contacts in and they're okay all day. Sometimes some over-the-counter, even the pill form of allergy medications can sometimes be a little bit helpful. Sometimes there's a little dryness involved in patients who use contact lenses, so there's a variety of things that could make a contact lens wearer uncomfortable besides allergies.
Well, so we have a question from Mary. She's saying her contacts are a little uncomfortable, even though she changes them regularly. Do I need a new brand, or should she come see the ophthalmologist?
Well, it may not be the brand. It could be the material that they're made out of. It could be the fit that may be a little bit off. If they're uncomfortable and a new pair doesn't seem to help, then it probably ought to be a visit to an eye care professional who can look at the contact lenses, make sure they're fitting properly. Maybe there is a little allergy to the material in the contact lens. Maybe the eye's a little dry and you need a contact lens that has a higher water content. So there's a lot of little issues there.
Someone asks, is it harmful to drive without sunglasses?
It's not really harmful to drive without sunglasses. If you do use sunglasses, you need to use sunglasses that have ultraviolet protection. Sunglasses that don't have ultraviolet protection are worse than no sunglasses at all. And you might say, well, what's that? Why is that? Well, sunglasses that don't have ultraviolet protection, the dark lens actually allows your pupil to get a little bit larger because there's less light coming into your eye, but it makes your pupil larger, and more of the light rays that with ultraviolet light rays get into your eye and can be more harmful than if you didn't wear them at all.
Even through the car window.
Even through the car window to some degree. Now, glass does help to block some ultraviolet light, but if the sunroof is open or the side windows are open and it's reflecting, all that stuff can be contributing to the development of various eye diseases that are related to ultraviolet exposure, like cataracts, macular degeneration, etc.
So we want to remind people you're watching LifeBridge Health Facebook Live with Dr. Don Abrams. If you have a question, please post in the comments section. So Helene said, are some foods actually good for your eyes? If so, what are they?
Well, there's most people with a normal diet, whether you have the right amount of protein and have a little bit of green vegetable now and then, you're probably fine with that. If you're somebody who doesn't have a good diet, then some supplements are probably good. Some vitamins are probably good for you. People that have early macular degeneration do benefit by certain vitamins and certain foods that have antioxidants in them. Some green vegetables, etc., are helpful to slow the progression of the macular degeneration type diseases. Everybody says, well, you should eat carrots because, Bugs Bunny can see really well with carrots. Well, carrots do have vitamin A, and that's essential for, maintaining good vision, but you get enough of that in almost everything that you're eating as long as you're eating a decent diet.
We have another question. I wear my contacts for more than a month. Some days I wear my glasses. Is it okay to extend wearing the contacts then to 2 months?
Well,
He's trying to extend the life of the contacts.
I don't know what they mean by a month,
Yeah.
whether they're taking them out every day.
I do take them out at night. Someone asked a question about that.
I'm not an advocate of people keeping contact lenses in for sleeping. I've seen too many severe corneal infections over the years where they are related to wearing contact lenses for longer than they should. Some people wear disposable contact lenses where they get a new pair every day, and that's great because you don't have to worry about cleaning them or any of that sort of thing. Some people have contact lenses that you replace them every 2 weeks or a month, but you clean them every night, and they are not in while you're sleeping. If the recommendation is change your lens every month, change it every month. Changing it every 2 months is cheaper and can cause you eye damage if you get an infection.
Someone asked, what is glaucoma and how often should I be seeing my doctor?
Well, glaucoma is a disease, essentially a lot of different diseases under the same category, but basically it's an optic nerve disease that's caused in most cases by an eye pressure that's a little bit too high for that individual. Years and years ago, we used to say if you had an eye exam and your eye pressure was less than 21, you were probably fine. But but eye pressure is a continuum, and just like you can have somebody with a high cholesterol and never get a heart attack, you might have somebody with a low cholesterol who has a heart attack. So with eye pressure, there are lots of people that are perfectly fine with not getting glaucoma when their pressures are in the 20s, and you can have very low pressures at 10 or 12 and you can get glaucoma. Everybody's an individual, which is why you should see your eye doctor periodically to make sure that you don't have it. Glaucoma, it can be inherited, so if you have a family history, you should certainly check that out. But generally, when the eye pressure is a little bit high, it damages the nerve in the back of the eye. And over time, you start to lose part of the optic nerve, and eventually you start to lose your side vision. Usually it's the peripheral vision that's lost first, and then you end up with what we call tunnel vision at the end. Unfortunately, when you lose a little bit of side vision, you don't often know it. You know, it's very subtle, it happens very slowly, so you may not recognize it, which is why a lot of glaucoma patients don't have any symptoms, and we pick them up at eye exams.
Someone saying, my eyes become very blurry and begin to burn while working on the computer daily. Is it time for glasses?
Well, you know, as I said earlier, you know, wearing the appropriate eyeglass prescription for the appropriate distance that the object you're looking at is important. Oftentimes, and myself included, if I'm working on something on my computer and I'm furiously typing away to write an email or something, I may not blink as much as I need to. And that could be a little bit of a dryness thing. So sometimes, you know, pre-treating yourself with an artificial tear before you sit down to do a long task may be worthwhile. I know when I'm in the operating room and if I'm doing some critical step of a surgery, sometimes I don't blink. I'm sitting there with my eyes wide open, and then when I get finished that, then all of a sudden I get very teary and my eyes are hurting a little bit, and I realize I'm just forcefully not blinking. So.
Someone asked about special coatings on glasses. Driving at night is difficult with all the glare.
Well, there's lots of different coatings that you can get on your glasses. There's anti-glare coatings, which they actually do decrease the reflection from your glasses, so people may not see as much of a reflection when they look at you. And to some degree, they can help with some reflections when you're driving and things like that. I have it on my glasses. I think for a lot of things they do work, but they're not perfect for everything. Driving, when people complain of difficulty driving at night, yeah, maybe their glasses aren't exactly right, maybe the prescription's not right. But sometimes people complain of glare when they drive at night because they have early cataracts. And it doesn't necessarily need an operation, but it could be a cause for people to have those sorts of complaints. It's not all related to their whatever glasses they're wearing.
Someone said I have a black spot in one of my eyes and it moves when I move my eye. Am I going blind? So this is floaters. People see these things.
Yeah, I mean, floaters are very common. If you all of a sudden see new onset of floaters, particularly if it's accompanied by flashing lights, you know, in the periphery, you really need to be examined. Floaters can be an indication of what we call a retinal tear or a retinal detachment, which is when the retina, which is the film of the camera kind of layer of the eye, if that gets a little tear in it, you can trigger those symptoms. So you really ought to be checked. Most adults at some point get an occasional floater, and as you get older, the rate of more significant floaters increases. Pretty much everybody over the age of 75 has got to have some kind of floaters, and a significant part of the population over 65 also has pretty significant floaters. If any of those floaters are accompanied by a sudden decrease in vision, you need to be seen right away, because if you do have a tear in your retina or a retinal detachment, fixing it in a very timely fashion is very important.
Someone said, what symptoms can determine if there's a high pressure in your eye, or what tests do you have to determine that?
Well, you know, in the office we check everybody's eye pressure to see if it's too high for that patient. Symptom-wise, the vast majority of the types of glaucoma have a slow rise in the pressure inside of the eye. So a lot of times, in fact, most of the time, there's zero symptoms. There are just no symptoms at all. Now, there are a couple of acute types of glaucoma. If you have a high pressure that's related to an inflammatory condition inside of your eye, sometimes your eye pressure can go up rather suddenly and cause significant pain, blurred vision, halos around lights. People that have what's called angle closure glaucoma, which is a type of glaucoma where the pressure can rise very, very quickly, can get severe pain, redness, blurred vision, and halos around lights, and actually to the point where you can actually feel like you're going to throw up. That's how bad the pain can be. So some of the more rare kinds of glaucoma can have significant symptoms, but the vast majority of glaucoma, which is the open angle kind of glaucoma, really doesn't have symptoms. And that's probably at least 80 to 85% of the glaucoma in the United States.
Linda said, I remember my mom always telling me not to rub my eyes as a kid. Is rubbing your eyes really harmful?
I mean, a little bit of rubbing is probably okay. Sometimes people rub their eyes because they're itchy. And if they're itchy, there could be an allergy. So you need to figure out what the allergy is. If it's an allergy to, say, pollen or something that you can't do much about, there are eye drops that can be used to help decrease that. If you're allergic to your cat, you need to remove the cat from the situation. Or if it's an allergy to, laundry detergent, you need to switch to something different. So you don't want to treat everything with medicine if you can fix it by removing the allergen. But there are a lot of patients that do have, hay fever type things that they just need to be on medications, eye drops, whenever their symptoms flare up.
You touched on cataracts a little bit. So what are the symptoms and how are cataracts treated?
Well, cataracts are basically when the lens of the eye, which is like the lens of a camera, starts to become hazy. And sometimes people just say things are just a little bit blurry. A lot of times they first complain of what I mentioned earlier, glare around headlights when driving. So sometimes driving at night can be really a problem for some of these people. Even if their vision is checked and is 20/20 in the office, you can still have significant blurriness and glare when you're driving at night. Sometimes people say they can't read that well. Sometimes they say that they feel like they need a lot more light in order to see. Cataracts early on particularly it's almost like wearing sunglasses permanently. The lens of the eye starts to turn a dark yellow as the cataract progresses, and it's just kind of like you've got built-in sunglasses. So those built-in cataracts are really taking away, half the light that's getting into your eye. So oftentimes you need to, if you're going to sit down to read, you need a light coming over your shoulder if you're reading some print. If you're reading, an electronic device like a Kindle or an iPad, sometimes you need to turn the brightness up. Oftentimes people open their windows a little bit more. They open their shades a little bit more. They position themselves when they're reading the paper so that light's coming in the right direction.
Is that a slow thing too? You don't realize you're making these adjustments?
For the most part, cataracts are a multi-decade development. There are rare occasions when cataracts can pop up very quickly. Sometimes they're in patients that do have inflammatory conditions, such as eye involvement in patients who have ulcerative colitis or Crohn's disease or rheumatoid arthritis. Sometimes cataracts develop quickly in patients that are diabetic. But the vast majority of cataracts, which are related to getting older, take a really, really long time. So you really don't notice that over time. And oftentimes early on, you don't really need surgery. You just get a better pair of glasses, and better lighting can help a lot of people.
And what is the surgery involved, or how do you know when it's time to go to surgery?
We usually recommend surgery when people aren't able to do the tasks they like to do. So if somebody is an avid reader and just can't do it anymore, that's a nice time to recommend cataract surgery. If they, have a great social life and they like to go places at night and they can't do it anymore, that's another reason to think about having cataract surgery. Cataract surgery is a relatively successful operation. It's probably over 99.5% successful for most people. In many cases, cataract surgery only takes 10 to 15 minutes. Most patients that have cataract surgery don't even go under general anesthesia. We just give them eye drops to numb the eye enough so that they can have the surgery and they feel nothing. So they come in, they get their preoperative eye drops. The surgery takes 10 or 15 minutes, and then we keep them and watch them for a half an hour, and then they go home. Most patients after cataract surgery can go back to driving within a day or two. We do like people to limit their activity for a week or so, no bending or heavy lifting. But most activities patients can go back to right away.
So you mentioned some illnesses that can affect the eyes, and someone has a question about diabetic retinopathy. So that's related to diabetes.
Right.
What is that?
Well, diabetic retinopathy is a disease where the long-standing fluctuations in blood sugar affect the structure of the really small blood vessels in the eye, in the retina in particular. And just as they affect the eye, they affect the kidney, they affect peripheral nerves. So when you get diabetic retinopathy, you start to have these blood vessels that become incompetent, that they can leak fluid, and you can get swelling in the retina, which causes blurriness. In some cases, they can start to have little areas of bleeding, and in other cases, some parts of the retina actually don't get the proper amount of oxygen because these vessels are incompetent, and to compensate, the eye starts to grow new blood vessels. And these new blood vessels can be very, very damaging. They can cause scarring, they can cause retinal detachments, and really, really significant visual loss if they're not taken care of right away. So anybody who's diabetic needs to obviously make sure that their blood sugars remain stable, and most people's primary care physicians emphasize that over and over and over again, and we do that too to our diabetic patients. Diabetic patients who don't have any eye disease that we can see still need to be seen every year, no matter how old they are. Any diabetic who has even the very minimal amounts of changes in their retina need to be seen probably at least twice a year. And those that do have more significant diabetic eye disease probably would be seeing their ophthalmologist or their retina specialists much more frequently than that.
So those changes can happen very quickly.
Well, it does take a long time for the diabetic eye disease to occur. Mm-hmm. So it's not like if you all of a sudden became diabetic that you're going to have diabetic eye disease within a week. Mm-hmm. It's usually people that are pretty uncontrolled for probably at least a couple years, if not longer, before things start to degenerate. But, a lot of people that have some early diabetic retinopathy have no symptoms. Their central vision seems to be fine, and it's only on an eye exam that we'll pick up that these vessels are incompetent. There's some leaky vessels, and if the leaky vessels aren't in the dead center of vision, people aren't going to notice that from a symptoms perspective.
All right, so one final question. Someone says, I have good vision. How often should I have an eye exam?
Usually if you're younger than 40, probably every 2 to 3 to 4 years is probably adequate. If you're older than that, maybe every 1 to 2 years. If you have a family history of anything, you need to be seen more often. For example, if you have a family history of glaucoma, if you have a family history of macular degeneration, you should be seen more often than that. If you're African American, the glaucoma risk is much higher than for Caucasians, so African Americans probably ought to be seen every 1 or 2 years after the age of 40, and if there's a family history, probably every year.
All right, well, that's all the time we have for today. Our thanks, Dr. John Abrams from the Krieger Eye Institute. If you'd like to find out more about the team and the services here at Krieger, please visit our website, which is lifebridgehealth.org/KriegerEye. And a note for those of us in the Baltimore area, coming up on Thursday, March the 8th, the Krieger Eye team will be at WJZ Channel 13 for Ask the Expert, a daytime broadcast. You can actually call in and talk to someone like Dr. Abrams from the Krieger Eye Institute. That's coming up on Thursday, March the 8th. You can find out more on our LifeBridge Health website. Thanks again to Dr. Abrams for taking the time, and thank you for watching. Be sure to like LifeBridge Health's Facebook page and follow us on Instagram and Twitter, and we'll see you next time.